I'm a social worker and certified alcohol and drug counselor here with Holland Hospital. I work for behavioral health services. So thank you all for being here. There are lots of handouts out front. If you didn't see those, obviously snacks in the back. Help yourself to those. I have a couple special guests with me here today. So I have Sarah Cohen. She is from Oregon Addictions Recovery, and she's also a social worker, therapist, alcohol and drug counselor. She's going to talk to us a little bit later about the brain and addiction and some treatments for addiction. And then I also have Tina Vandagucci. She is a health coach for Holland Hospital. She works for the Healthy Life program, and she is going to talk to us later about her tobacco-free program. So let's go ahead and jump in. So we're going to talk to you about vaping, risks, addictions, and treatments. So some things that we'll cover today, as you probably already saw in the PowerPoint: what is vaping? What are the health risks? How does addiction play a role? What treatment works? And where can you find treatment? So it's important to, we've all heard about vaping in the news and the vaping illnesses and deaths that have happened. So I think it's first we should kind of describe what vaping is. So it's where you actually inhale chemicals through a device like an e-cigarette or a vape pen, a juul pen. It's called vaping. Juuling is, I guess, what the young people are calling it. You most likely will be inhaling chemicals like nicotine or THC. Those are most common substances that people use to vape. And basically it started out in 2007 and was advertised as like a safer alternative to smoking tobacco and tobacco products. And what we've learned is that that's very questionable because there have been very, just a lot of lung illnesses and even deaths that are linked to vaping. So it was, it's been advertised and very much geared towards young people, so it's very popular in young people for multiple reasons. I think one of those reasons is because some of the vape pens are like in the middle there, you'll see, I think I have a pointer on here. Right there, it looks kind of like a USB or like a flash drive. So it's easily concealed. You can slip it into your backpack, take it to school. There have been a lot of news reports about using in the bathroom and vaping in the bathroom. It's kind of a common thing. Heard that from parents in the community and that kind of thing. So, and then there's also I'll talk a little bit more about this later, but some of the flavorings that are geared towards younger people, like cotton candy, gummy bear, creme brulee, fruit medley, things that are enticing to the younger population. So when we talk about these vaping illnesses, I just wanted to talk about a few statistics that we know. I developed these slides last week, so the number has probably grown since then, unfortunately. But there have been over 1,000 lung injury cases reported that are linked to vaping or e-cigarette use. 21 deaths confirmed in 10 different states. And we've actually had our first death in Michigan last week was that I just read in the Grand Rapids Press. And we've even had some illnesses here in our emergency department that are linked to vaping as well. So all the patients that have these lung illnesses have had a history of e-cigarette use or vaping products. They are saying that the CDC, this is all from the CDC, the Center for Disease Control, they say that THC actually does play a role in the vaping illnesses. So they're saying about 70 to 75% of the people who have these lung injuries actually had a combination of either just THC or THC plus nicotine. And then there were some cases that were just vaping nicotine as well. So either a combination or one or the other. So 2/3 of the patients who had these lung injuries were young people. So people of the ages to 18 to 24. We know it's very popular among young people, so that's not really surprising to me. But you can see that's very much premature to be having these type of lung injuries. What they're saying is that, and we don't actually know what is causing the illnesses and the symptoms, but what they think now, the CDC thinks, is that it's mostly likely caused from a chemical exposure. So something that's happening in the, when you heat up the substance and then you're inhaling it into your lungs, it's acting like a toxic gas that is causing these like pneumonia-like symptoms. So, shortness of breath, chest pain, trouble doing your routine activities, you get tired very easily, cough, fatigue, weight loss, fever. It looks like you have the flu, right? It looks like pneumonia. You might think it's, a cold coming on, but it just progressively gets worse to where people have had to be ventilated, putting on a respirator to breathe for you. And it's a very serious problem. So this is just another slide that I pulled from the CDC talking about some of the other chemicals that have been linked to vaping and some of the vaping cartridges. The metals and nickel, tin, and lead, probably from the heating process, from the actual vape pens that's ending up in people's lungs. So when we talk about vaping, we need to address the fact that people are inhaling addictive substances, right? So the most common things that people are vaping are nicotine and THC, which are both highly addictive. So a few things to note. The Juul cartridges, so Juul is a brand of like a vaporizer or e-cigarette. And some of the Juul cartridges can contain as much nicotine as 1 pack of cigarettes. So if you think about young people who are maybe naive to smoking or vaping, and they go and buy a Juul pen, and get a pack of cigarettes basically in this cartridge and smoke it in 2 days, you can see the issue there that, nicotine is highly addictive, and they're more likely to become addicted faster if they don't really know what they're smoking or how much they're smoking. They've actually talked about doing some surveys with high school students who are vaping, who actually think they were just inhaling a water vapor or just flavorings, when 99% of the cartridges that are sold do contain nicotine. So there was some, misinformation, and advertising makes it look safe and a good alternative to smoking tobacco because there's less chemicals, which, makes a lot of sense, I think, to the, the consumer. So, we talked about the flavors already being enticing. They've actually said that teen use doubled from 2017 to 2019, and that's just for vaping. So we've kind of seen this wave of younger people now vaping, and for a long time with, the Truth Initiative and some, trying to kind of squash the tobacco use, we've seen a lull, and it's actually declined in the past 2 to 3 years with smoking tobacco products, but then we've seen an increase in vaping. So it's just kind of switching one nicotine for another. Obviously, they've advertised it as a safer alternative, so that's, people's reasoning from switching to tobacco products to vaping because there are less chemicals involved. But they're still having that same, nicotine intake and that kind of thing. So the last thing I want to kind of talk about before, what's that? Yeah, so we don't know exactly.
But it all comes down to a blender. It really does.
Yeah.
It all comes down to who's blending it and what are they putting into it.
Yeah, and I think that's what the CDC is trying to kind of find out, like where are the the toxic chemicals coming from, and what exactly is it. And we'll have some time for a question and answer at the end too. Okay. So teen use is especially harmful because of developing brains. So we know that teens or young people's brains don't develop fully until they're 25. And so if we are putting this addictive substance into young brains, it will have, it will kind of start that addictive cycle. So, when you inhale something that's addictive, like nicotine, highly addictive, it kind of spikes and you have this euphoria that happens, right? Where you have this dopamine release in the brain, and then you have a crash, you take another hit, there's another euphoric, dopamine release, and that kind of creates that addictive cycle to start. And, you do that so long, and it doesn't take very long with nicotine because you become addicted to it very quickly. You will become addicted and you will start to crave the drug, and you will start to have withdrawal symptoms. So with young people, our brains are still developing and still forming. A lot of the withdrawal symptoms that are caused from nicotine are like irritability, right? For anybody who's tried to stop smoking before or known somebody that's tried to stop smoking, irritability and moodiness is a big part of that. Sleep problems, insomnia, trying to focus and concentrate, it could be an issue as well. So some things to kind of keep in mind that, it kind of starts that reward cycle where it kind of messes up that reward system in our brain. And Sarah's going to talk more about that too. So, it's important for us to mention that here because, it's not just necessarily about the health risks with the new, vaping illness and lung illnesses that are happening, but also young people becoming addicted to nicotine. So, Sarah, do you want to come up and, so hit that to go forward.
Okay.
Yeah.
Okay, so so much of what Stephanie was talking about, so many of these physical health concerns, that sounds really scary to me. And there's so much that we're still learning, and that's a big part of this. But we're kind of talking about a wide spectrum of how vaping is really affecting a lot of different populations too. And so we have the physical health concern. But what I want to talk about is kind of a bigger piece to all of this, and that's addiction. Because what we know is that there are a lot of harmful substances out there. We're talking about mind and mood altering substances that have addictive qualities. And so in order to understand what some of the impact of addiction looks like, we have to understand addiction as a brain disease. And that helps us to better understand what are some of the risk factors, especially as they apply to younger people. Because the majority of the risk factors that we see to addiction, we're identifying in that younger population. So in understanding addiction as a disease, it is a process that involves repeatedly engaging in a specific activity or behavior in spite of negative consequences that result from that activity or behavior. And this makes a challenge too, as we diagnose here on the spectrum of symptoms, that a lot of times that we see people using substances for the simple fact, you guys, that drugs work. And that's just the honest truth of that. It works in that short term. It works on releasing somebody from experiencing pain, emotional and physical pain. It helps people to deal with stress in that immediate, short-term kind of fix. And it helps to create that sensation of pleasure. Unfortunately, we see a lot of long-term consequences that can also come from using these substances. And a big part of seeing this in the younger population is that we start some of those changes in the brain that can actually set a person up for greater risk for more problems later on, especially that maybe we're seeing a progression of an addiction. And so when we look at addiction, when we look at diagnosing an addiction, we look at it as a spectrum. And so when we look at the mild, the moderate, and severe, and we look for different symptoms that are kind of hitting in those kinds of areas. So in the mild cases, we're going to only see maybe like 2 to 3 of the criteria. And when we see somebody progressing more to severe, we're seeing 7+. So that's kind of what we look at. The challenge is that, again, when we're looking at a younger population, we're seeing a lot of the symptoms that might look like maybe these are early signs and early symptoms of a progressive brain disease like addiction, or maybe we're seeing someone that is in kind of that experimental phase. Maybe we're seeing someone that is just, trying some different substances out. Maybe they're just going through a really hard time that we can all probably relate to and are looking for something for that immediate kind of relief. And that's really hard to be able to understand until we start to understand what some of the additional risk factors are. And so looking at a younger population, like Stephanie mentioned, we see an underdeveloped brain. And that puts somebody at much greater risk for how the brain is actually being impacted at those early stages. So I'm always a little hesitant to jump into this because what I'm going to do here is like a little bit of neurobiology in a nutshell for you guys. Because I find that this is really where we start to better understand when we're talking about addiction as a progressive disease and we're understanding some of the risk factors that we want to be aware of, is that we have to understand what exactly addiction looks like. And so when we first started calling addiction a disease, this was in about 1939, I think was the first publication by the American Medical Association and Alcoholics Anonymous that started calling addiction a disease. But it's only been in the last 20 years that we've really had the evidence, the scientific evidence and research to be able to back up those predictions, those hypotheses. And so when we first started looking at addiction and trying to understand it as a disease, we assumed that it was affecting the frontal cortex. Because our frontal cortex is where our relationships are, where those are formed, where we start to give things, where emotions really start to take play in our relationships, how we give things spiritual meaning, how we give things moral meaning. And so it made sense that when we were seeing someone struggling with addiction and behaving in ways that aren't really characteristic of maybe who we know for them to be, we assumed that, yeah, it would make sense that it was affecting that frontal lobe. And anybody who has known someone that's maybe struggled with addiction, you can see a lot of those personality changes start to develop. And that this kind of helps us to better understand maybe why that is. So then we started being able to do brain scans. We started being able to see a brain in the midst of a trigger or craving. And it wasn't the frontal lobes that we were seeing light up. It was the limbic system. It was this part of our midbrain, which is also our survival network. And so that's important because our survival network really communicates to the rest of the brain of what is important for survival. And it does that, not by thinking or reasoning through or looking at everything that's really involved in it, but it does that by the amount of dopamine that is created by that activity or even that substance. So things that are important for our survival, like food, oxygen, water, all of those things create levels of dopamine in our brain, and we experience pleasure. And that part of the brain kind of communicates to the rest of the brain, go. That's important. That felt good. That's important. We need to have more of that. And so without really thinking through it, we get those kinds of urges that we need to go find some more. Then we have the frontal cortex that really starts to kind of regulate some of those choices and some of those behaviors, and it kind of puts that stop in place. And it says, okay, so we need food, we need that for survival, but we also have to think through this. And we've got relationships to think about, we have morality to think about, we have our emotions, we have other people to think about, and it kind of works in a good decision-making kind of process, right? So what happens if we are continuously putting substances into our brain that are not creating just those normal levels of dopamine, but we're seeing spikes in dopamine that our brain is really not designed to experience? That starts to cause a problem. And the first problem that we really can focus on is that, I mean, if the brain is registering these spikes as that felt good, that's important, we should get more of that, what happens when we start to experience those large spikes? What is that limbic system going to register? That felt really good. We need to get more of that. So it starts to give a survival value to that drug that the brain, that the drug really doesn't deserve, right? And so that's the biggest challenge, is that it starts to kind of override, and it starts to then kind of force a disconnect, really, through that frontal cortex and that midbrain. That creates a lot of challenges, and that's when we start to see people continuing to pursue the substance despite having those negative consequences, or we start to see them behaving in ways that aren't characteristic for maybe who that person really has been in the past. They start going against priorities, values, goals, that start to cause a lot of disruptions in their life. So another challenge that we start to see is that the brain, like any kind of system, wants to be in balance. So if this is like our pleasure threshold and we have those dopamine spikes that feel good and our brain registers that feels good, again, when we're constantly putting higher levels of dopamine surges into our brain over and over, guess what our brain's going to start to do? It's going to start to reset. It's going to start to try to find that balance. And all of a sudden, that pleasure threshold starts to reset. And so those substances that we're putting in our body that were creating those great feelings of dopamine are now not doing enough. Now we need more. Now we need more of that substance to be able to create those levels of dopamine. And what happens when we start to experience some of those normal experiences of pleasure, like spending time with family and friends, eating chocolate, exercise even, they're not hitting that same kind of pleasure threshold. And that makes it really hard for a person to be able to find some of those healthier coping mechanisms after long-term use and to be able to kind of put a lot of those enjoyable pieces back into their lives. And so those are a couple of the things that we see when we examine addiction as a brain disease and some of the challenges that you can imagine that it creates for people moving forward. And so when we're looking at an underdeveloped brain, when we're looking at an adolescent brain that is a whole lot more vulnerable to some of those substances, I don't know about you, but that makes a whole lot of sense, so that's much more concerning. And unfortunately, we do see a lot of substance use starting in those adolescent years. Those are hard years. I don't want to go back to those years. I don't know about you. But there's a lot of emotional vulnerability that we can all probably relate to experiencing through those adolescent years. And so not only do we have a vulnerable brain, but we also have just vulnerable emotions that people are trying to deal with. And then we find a substance, whether that is vaping, whether that's nicotine, THC, alcohol. We find something that offers a very quick relief from stress. It offers us a very quick kind of escape from life. And we find a lot of those kinds of escapes in different ways, but some that are going to be a lot healthier than others because they're not going to come with a lot of the consequences. So again, when we're finding things that work, like drugs in that short term, what we also see is that individuals, and especially young people, are kind of setting themselves up in a way that if I found this coping mechanism that works so quickly and so efficiently, guess what? I'm not really developing any other ones. I'm just kind of sticking with this one. And then the consequences start to build, and then we've got a vulnerable brain, and then we have a person that does not have the same variety of coping mechanisms that they might have had they been working through the stress and working through some of those challenging emotions rather than stepping out of them. Does that make sense?
Yeah, something else to add is that
Yeah.
a lot of the companies that are gearing these products for young people, they're aware of this, right? They're aware that teenagers and adolescents and young people have vulnerable brains, and they are going to get hooked, right?
Right.
And then that is eventually ends up ruling them, right? Because you're dependent on the cigarette, you're dependent on the vaping product, and that is only good for the companies, right? Not for the person. And also not developing some of these other coping skills and things. Yeah. It just becomes, something that kind of rules your life eventually. So.
Okay. Can I pause there if there's any questions when it comes to addiction as a brain disease? Okay. If there are questions that come up later on, then write them down, hold on to them, and hopefully we can come back to them too. So as we kind of work on assessing addiction, and we can be able to identify some of those risk factors of someone starting use of substances earlier, somebody that has maybe some more mental health challenges or just stressful experiences in their lives. Those are all going to be risk factors to somebody turning to substances and developing more of a dependence on certain substances. And then, of course, I don't think I mentioned this, but when somebody is starting use younger, especially before the age of 14, we see somebody about 4 times more likely to develop an addiction. And the vulnerability of the brain to begin with. Addiction is genetic, like a lot of our progressive and chronic diseases are. It doesn't mean that just because somebody has a family history of something that they're going to develop that problem, but it does put us at great risk. And so those are all kinds of pieces that we want to consider. Some of those are avoidable. I know that with my own family history. I have diabetes on both sides of my family. Today I'm not diabetic, and hopefully I'm continuing to put some of those pieces in place in my life that can reduce my vulnerability in a lot of ways. The genetic piece is there. But if we can work on people developing some other skill sets to be able to reduce their risk to a chronic disease that they might already be vulnerable to, that can really set them up in a really positive way. So, what do we do when somebody does have an addiction, when they are ready to kind of take that step forward. And a big piece of that is treatment. I mean, people come into treatment for different reasons. We were just talking about in one of my groups the other day is that nobody comes to treatment because they want to stop using. People come to treatment because they want to live a better life without the use. They want to be able to be free from it, and they want to be able to live without the consequences that are constantly weighing on them because of it. And so we work on being able to develop different coping mechanisms. We work on being able to understand that this is not just about a drug. This is not just about a drug problem. This is about a thinking problem. And then we can start to work on identifying that stop and go kind of system of the brain of like, when is the brain kind of overriding some of that decision-making process and saying, go, 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 go get more? How do we start to identify those kinds of thoughts and being able to put some different things in place to be able to respond to those cravings and those urges in a different way? And so we use a lot of different practices, a lot of evidence-based practices that come up from cognitive behavioral therapy, where we're working on correcting problematic behavior by applying different skills. So that's a lot of understanding how the thoughts affect our behaviors. Dialectical behavioral therapy, we're seeing a lot in the substance abuse treatment field, and that's a lot of mindfulness, it's a lot of emotion regulation. How do we create habits and patterns of behavior that reduce our vulnerability to intense emotions? How do we work on distress tolerance of when my intense emotions are like up here? How do I work on bringing them down a few notches so I can be able to cope differently than just turning to substances as a way to do that? So we work on equipping people with some of those different skills to respond to life differently. Motivational interviewing is a lot of that piece of how do we start to help people to take ownership of their own goals and help them to be able to move forward with those goals and finding that internal motivation, because we can tell people that they need to change or that they need to be doing something differently, but I don't know about you, but that's never worked for me. It has to be something that the person is ready to take some of those steps forward, to be able to set their own goals and find that internal motivation. And group therapy and community engagement, that's huge. Holland has a really fantastic recovery community. And it seems to just be continuing to grow with a lot of different resources that are in place. Smart Recovery, Celebrate Recovery, in addition to a lot of the 12-step meetings have been really great for people to be able to connect with others who are seeking to live differently, to be able to be in a community of people in recovery, or being able to be with other people who are striving to respond to life differently. That you're not just there kind of like listening and helping other people who might be struggling with you, but you're seeing other people further along in their recovery and being able to see that people do this. People recover. People live different lives despite how ingrained and how entrenched some of these habits and some of these behaviors can be. Despite how powerful addiction can be, we see people recover every day. So those are some of just the general practices that we see or that we work through when we're working on addiction treatment. And I think we're going to get into a little bit more specific to vaping, right?
Yes.
Okay.
Yeah. So I'm just going to talk about the next slide, treatment, like what can you do specifically to stop vaping. So I just had a few, bullet points here. If you are someone who vapes or know someone who vapes, and these are just some first steps that you can take to stop. So, it's really important to have an environment that creates change for you, right? Having vape pens around, having your cartridges around, having things that remind you of vaping is going to be kind of counterproductive. So, removing them all from your house, not having them around, those would be triggers, right? Those are the things that would trigger us, the things that make us want to vape. So avoid them if you can by removing them from your house. There's other triggers like, maybe you vape and drive. So maybe it's doing something with, chewing gum or something while you're driving, or listening to music, or listening to an audiobook. Having kind of an alternative behavior when you have a trigger, and then when that progresses into a craving where you're feeling that physical response for the drug or for the nicotine or THC or whatever it is, then you have some strategies and some tools kind of in place to go to. So things would be like, trying to exercise or, call friends, those are, go for a walk. Those are the most common, but, this is something that you would work, with a therapist on, or, trying to talk to, other friends who've stopped smoking or stopped vaping, what have you done, that kind of thing. So a couple other things, you can talk to your doctor about Chantix or Zyban. So these are both medications that are prescribed by a doctor that can help lessen cravings for nicotine. And they are only approved for people who are 18 and older. So adolescents would not, it's not indicated for adolescents. The same thing with the nicotine replacement therapies, the gum, lozenges, and patch. Those are also only approved for people 18 and over, but they have been very effective for people to stop smoking because they kind of titrate you off of, and they're much safer than vaping, as we know, and much safer than cigarette use as well. So acupuncture is another one that you can try, and Sarah and I are both certified to do acupuncture through the ear for addictions. It's called auricular acupuncture, and if you want more information about that, we could talk later. And then lastly, ask friends and family, to help and to support you. Tell the people around you that you want to stop vaping. Tell the people around you to not vape around you. And, just, having somebody that you can call if you have that trigger, that craving. I'm going to pass it on to Tina, and she is going to talk more about her tobacco-free program and how it all works.
Good. You're experts. It's wonderful, wonderful information. I just taught today. I do teach the tobacco-free classes at Holland Hospital and Healthy Life programs. I had 2 classes today. I just came from one. So I happen to have some of my paraphernalia for the class in the car with me. So I just thought, if you want to come up and look at it after we're done. This right here in this, pass it around, in this container is a year's worth of tar. And I'm talking, this is, again, tobacco from smokers, people that are smoking. However, we're also discussing nicotine. So this is for someone that would be smoking a half pack a day. This is what would be going through your lungs. You need to filter through this every day. So I want you to pass that around. That's a half pack a day. Obviously, there's also going to be issues. This is Mr. Grossmouth. And also I do have, nicotine can come in the form of chew as well. So then you're actually going to have a lot of mouth issues and teeth and gum issues. So I'm going to let you guys just pass this around and take a look at Mr. Grossmouth.
Have fun with that.
And then this is actually quite outdated. So I mean, probably double this. These are the chemicals that are actually in cigarettes. So, and the problem is we don't even know about a lot of these chemicals that are in the vaping paraphernalia. But if you can come up and read these later. I mean, some of these there's methanol is also used as rocket fuel. Hexamine is an explosive ingredient. Formaldehyde, embalming fluid. Polonium-210 is a nuclear waste product. So this is what your body has to process, and this was way back. Cigarettes have gotten so much smarter. They put a little bit of money into research and development so they know how to hook you and reel you in. There's no coincidence that way back in the days of spring breaks and spring break in Florida, where they are actually giving away packs of cigarettes. It's actually, some say that in 1 pack of cigarettes is enough, 20 cigarettes. That's why there's 20 in a pack. It's actually enough to addict you. So they give you a couple packs of cigarettes. And way back when, with our military, they were giving away 3 cigarettes. And I cannot think of anyone I've ever had in my classes through the years that has not started their nicotine addiction as a teenager. Every single one of them has. I always ask, when did you start? They started as a teenager. So you can make it through those years. So I'll do this one here as well.
There's actually on the first slide that I had, the propylene glycol is one of the chemicals that is usually found in some of the vaping cartridges, and that has been linked to cancer. So we do know that.
You're passing around the jar of tar, right? So in regards to that, this is an actual biopsy of a lung. So this is a nice, beautiful, healthy lung. This is about what it should look like. There might be a couple specks in there, but it's a pretty nice white-looking lung. So again, you can come up and look at this afterwards. The next one, that jar of tar, you saw what that contains. But this lung right here is cancerous, it's black, because it's got to filter that jar of tar. And you can actually read this, what this person was, a long history of cigarette smoking. It's age 65, male, age 65. And then we develop, some people develop the COPD, chronic obstructive pulmonary disorder, and actually get down the road to getting emphysema. So this lung tissue is gone. It's not, there is no filter. So you can take that jar of tar, this is going right on through. There's no filter anymore. And you cannot regrow these tissues back. So this is what emphysema looks like. So one of the things I wanted to address, and I do have the tobacco, I teach a tobacco-free class. I do that for some corporations. But right now, if you're interested, that is something that I do one-on-one. And I have flyers back there. But I'm also a personal trainer, wellness coach, strength test for breast cancer, a lot of anything health and fitness-wise, that's me. So I'm going to, obviously, as the health coach, into any addictive disorder, any disorder, or anything that you want to improve your body, I'm going to look at the whole person approach. And these guys are mentioning a bunch of things that you kind of want to line up. I want to go and make sure that we really cover the practical lineups, how to set the stage for us to have the best success to actually overcome addiction. And I have used this acronym called New Start for my career as a health professional. And if you can just simply remember that New Start acronym, I think you'll be better off. The first one that we have is obviously nutrition. Now, these, what do we have? 4, we've got 8 different things here. These are all really vital to your whole person health. And you will find if one of these things, if even just one of them is out of whack, there'll be a sinkhole. And I think sinkholes, I kind of put things in a little bit more layman's terms. A sinkhole would be something like being tired, being thirsty, being hungry. When you're set up in this type of a condition, you're more likely to engage in harmful behavior. And if not, I'll put it this way. So if you're tired, are you going to make a better choice? If you're angry, anybody ever been angry? You know, how are you going to make the best choice? If you're super lonely, if you're depressed, if you're stressed, those are often the times that addictions will come calling and luring us and pulling us in. So I want you to be able to set the strongest stage for your, I like this almost like brain fitness, brain balance throughout your life, throughout your week, so you're a stronger person to help you overcome addiction. So these are very practical ways, but I definitely want to say there are times when you definitely need the treatment, you need the experts, and I love the whole person approach and working as a team. And with the Healthy Life programs, I work with Stephanie and also Dr. Kyla Murphy. We actually call it lifestyle medicine because it's not usually just one thing. If you just exercise, your life isn't going to be perfect. And if you just get one other issue just right, yes, you're drinking all your water, well, life isn't necessarily going to be a bed of roses. So there's a lot of different components that pull into lifestyle medicine, and I actually have a handout back there if you're interested in that as well. All right, let's get back to the slide here. So, and make sure you cut me off when you guys need to, because I can talk on this as long as we want to. And you can feel free at this point to ask me a few questions as we go through. But you see that blue triangle right there? So, nutrition. I put a blue triangle up there for you guys to remember that is actually the way that you want to eat. Eat like an upside down triangle. Typically, if I surveyed most of you, how many of you had breakfast this morning? And what did you have for breakfast? Ooh, that sounds pretty good. What did you have for breakfast back there? With the white sweatshirt, yeah. So, okay, and right next to you? Same. Okay. Anybody skip breakfast? Uh-oh, we got a couple of breakfast skippers back here. Are you getting hungry about right now? So you know if you've had good supper? A typical American is many people come in and say, oh, I don't like breakfast. I don't eat breakfast. It makes me nauseous. Or I don't have time for breakfast. or they start with something pretty small, and they do pretty good throughout the day. So maybe they're watching their calories throughout the day. Well, I just had maybe 50 calories, or a small yogurt, or just something small. And then they'll stave off, and they'll wait till lunch, and maybe have a decent lunch. So maybe they have 500, 600, 700 calories in them by now. But now it's supper time, and maybe they haven't eaten all day. Anybody ever just keep looking at every single cupboard because you just haven't quite filled that hunger yet by the end of the day? So the typical American diet is this way. We eat very little for breakfast, and then we just eat and eat and graze and graze and graze and just, because we didn't eat enough calories throughout the day to balance the brain. That fuel also goes up here. It's not only your physical energy level, but if you can have a balanced brain, you'll be making better choices throughout the day. Again, super hungry, skip lunch, got a power meeting. How on are you going to really be going into that meeting if you're yawning and if you're taking one of these drops right here? Or, you've maybe caught when did the Starbucks caffeine and a sugary donut or something like that, and you're way up here. And everybody ever get a sugar buzz, brain fog, that type of thing? Well, actually, alcohol ferments into sugar ferments into alcohol. So sometimes that is an actual thing. So I'm suggesting the upside down triangle breakfast like a king. I don't care if you didn't eat the rest of the day, but have breakfast like a king. I like when you guys are having some decent breakfasts in the back row, except for you guys over here. But this is your fuel for the whole day long, and I would encourage power protein in the morning. The power protein. It's brain food, yes. As you're wavering throughout the day, you didn't eat yet tonight, you go home, I would say have some easy to digest carbs. Actually, have some breakfast food. Have a toast, have a banana, have a bowl of cereal. It's just nice and easy. It doesn't require a lot from you, and it actually produces some nice dopamine, serotonin, maybe a bowl of pasta, something. That's where the comfort foods, that's called comfort food for a reason. But if you have that type of bagels and just pure carbs for breakfast in the morning, you're going to get that up and down crash. So make sure you're getting some protein, power protein in the morning. Eat a big breakfast. And if you tell me, I'm not hungry for breakfast, it makes me nauseous, okay, for 2 nights in a row, skip supper or don't eat after 5 o'clock. By the next morning, you'll be hungry. So if anything, if you're not feeling quite right, or you're rushed, you're late, your gut's upset, you're probably okay to skip supper. Nobody really had an issue with skipping supper, unless there's diabetic issues here. But we're really designed to run on a full tank of gas in the morning.
And yeah, go ahead. I was just thinking, 'cause I definitely know the hangry that you're talking about. And when you think about when you're already overcoming addiction, when you're already trying to work through same mindset, work through what's creating those cravings, what's creating a lot of that just kind of upset. If you're not focusing on some of these things, you're not reducing some of the additional challenges that it's creating. So a big thing that we do focus on in any level of treatment is how are we reducing some of those things that we can control, even if that's as simple as eating breakfast. It's a simple thing, but it sets you up for more success.
To avoid some of these hits, getting hits all day from different things, and we cut out some of those hits. So and so mostly plants. Live, fresh food. I used to carry around a demo, actually from my sister. She took it out of the back of her car after about 3 years. It was a Happy Meal. A Happy Meal. And I took it, I would show you, and it looks just like a Happy Meal. And 5 years later, it still looks like the same Happy Meal. So here's a little, if I can get this right, if it doesn't mold or sprout, throw it out. Because all I needed to do was stick that thing in the microwave. It didn't even mold. So don't try this at home. So we want live, active, get most of our nutrients from multiple plants. Okay, exercise, yes. Somebody of you guys just stand up for a moment. What you're doing right now, if you just stand up for a moment, shake around a little bit. You're now sending some of the blood that was in your feet, toes, because you might have been getting a little sleepy. We're just moving it back to the brain. If your brain's not getting circulation and fresh oxygenation, it's hard to make good decisions. If you're feeling constantly tired and not energized. So simply sitting less. There's a statistic, a study. All right, so this is something you can try at home. If you simply stand instead of sit for 2 hours a day, 5 days a week. So if some of you are working 5 days a week, you can actually get paid to do this on the job. Where you used to sit in your day, if you simply stand for 2 of those hours, you will lose, in a year's time, women will lose 10 pounds. You've changed nothing else at all. And men will lose 13 because you have a higher metabolism. So simply standing 5 days a week, 2 of the hours where you used to sit. That's how it actually burns about 135 more calories per day by just standing for those 2 hours. It adds up after a year's time. So, okay, you guys can go ahead and have a seat. So simply moving more, specifically, yes, you should, if you're starting on tier 1, you need to accumulate. Every American should accumulate 30 minutes per day of movement, and 80% of Americans don't. So, and I'm just talking, running, walking through Meijer, going getting your groceries and, maybe breaking some leaves and walking out to the mailbox. If you added that up for you yourself, do you move 30 minutes a day? So I know there's some people that maybe from the bed, they're going to drive, they're going to drive to work, they're walk a few steps, they're into work, then maybe have to walk to the copier a couple times. Then they're going to, on the way home, they're going to go through a drive-through. They got to get to the kitchen table, to the recliner, to the bed. How much do they move per day? So that 30 minutes is vital. From there, work your way up, so that you're actually getting 30 to 60 minutes of good cardio movement every day. 8 cups of water a day. I'm going to tell you 2 awesome things about water that you probably didn't know. I would suggest 2 cups of hot water first thing in the morning upon arising. So nothing else. This is not coffee. I'm talking a little lemon in there. Wonderful. It's excellent. Your stomach will love it. There's nothing in there. You've been dehydrated all night long. Some of us are talking about headaches. Do you make a great decision when you have a headache? Are you more apt to go for caffeine, nicotine, or something else to bring you that up? You may simply just be dehydrated. A lot of times we have cravings. We have addictions. We have cravings. Well, if I was a smoker, I have a craving. I might think I need a cigarette, but maybe you need an orange. Maybe you don't have. Maybe you're thirsty. You're dehydrated. I have a testing machine, body composition machine, and I'll test many people out. Almost everyone comes in chronically dehydrated, and it'll show itself. Dehydration shows itself in brain function, body temperature control, and blood pressure. 3 ways that often is high percent cold food, those types of things. So just something to think in mind. So can you put a check mark? Yep, I'm getting my 8 cups of water a day. Here's a way. Yep, quick question.
When you're dehydrated, is it raise or lower blood pressure? You have less volume, hence lower blood pressure?
It probably would tend to raise your blood pressure.
Oh, it does?
Yeah.
Even though you're
Let's say it affects blood pressure. Because a lot of people who have high blood pressure get put on a diuretic, right? To get rid of the water. So it's definitely related to blood pressure. I'm not going to tell you exactly how, but it's water balance and blood pressure. You figure it out. All right. With water. You gotta try this. At home. So after your next hot shower, don't do it tonight. But if you feel you have a craving and you're sluggish and you need a pick-me-up, go get in the shower. Take your normal warm hot shower. But tomorrow morning, do this. At the end of your shower, turn off the hot water and just stand there. Yeah. It is an amazing Red Bull rock star pick-me-up because it actually is boosting your white blood cells. And to get even better, go like this. Underarm, because we're talking lymph nodes, go right here, lymph node, right here, chest, turn around, back, okay, front, groin, okay, and you're out.
And we actually do use cold as like a soothing sensation kind of like technique. Cold has a way of kind of shocking ourselves out of like some of those like cravings or even just some of those intense emotions. Even if it's as simple as just running your hands under cold water and just focusing on what does that cold kind of feel like. It can really do some amazing things.
Like a distraction technique.
one thing.
Mhm.
For smoking, I often say, try to find, when you're having a craving, go do something that you can't do and smoke at the same time. How many of you have ever, or do you know people that can smoke in the shower? Or maybe some, you know, so that's what I'm
Try it.
Give that a try. Give the water a try. Sunshine, 10 minutes per day. That's going to help. You know, do our moods in Michigan not get affected by the sunshine? So you know, that's your own research experiment. We need that sunshine. Here's the trust, your support system. It may be your religion, your spirituality, I like to also pull in your relationships, your support system. If you are living on an island and not connected, there's a very isolated feeling, and that can be the loneliness can also lead to, I need something, I need to fill this vacuum and this craving. So that's another thing, check that one off. Air, fresh air is the best. Deep breathing exercises, well, what are you actually doing when you're vaping and smoking?
I have an interesting example of that. So when I would run therapy groups, a lot of people would say, well, smoking calms me down, but nicotine is actually a stimulant, right? It actually ramps us up. It's much like caffeine. Stronger version is cocaine, right? It's a stimulant. It kind of activates and stimulates everything. And I think part of that might be the fact that, you know, obviously you're satiating the craving, right, for the nicotine, so that's kind of calming. But also there's that inhaling and exhaling kind of thing going on with vaping or cigarette smoking. So I think there's probably, you know, a lot of people that do.
Very, very soothing. And we want to definitely increase our lung capacity. Now, if you're exercising outside in the fresh air, you can get a lot of these all at one time. Extra credit. You're going to feel like $1,000,000. Exercising actually releases energy, glycogen, out of the muscles, and that's why you have more energy after when you're exercising. And it releases a lot of the wonderful hormones that will help us give us kind of that dopamine and some of the feel-good hormones you can get through exercise, specifically high-intensity exercise. And exercising will help you sleep better, producing tryptophan, which processes over into melatonin. Does that sound familiar? So see how these are interconnected? And you may be having all of these perfect except one. Sometimes it just takes that one where going down here to temperance. Moderation of what is good. Because you could overdo any one of these things. You could sleep for 12 hours a day. That's not really good either. And I know I had a little sun cancer, skin cancer in my nose. If we get too much sunshine, so moderation of what is good, avoid what is simply harmful. Avoiding what's harmful. And to mention my last comment will be early to bed, early to rise. I also do sleep science coaching and to help with sleep hygiene issues. And the one thing I can tell you is every hour of sleep before midnight is worth 2 hours of sleep after midnight. You cannot make it up, so don't stay up till 2, because you can sleep until 10 that day and get your 8 hours. It's not the same. Much better off to skimp on your total sleep time if need be, but be in bed by 10 p.m. Hours of power for your body to get the deeper sleep and the REM sleep and the non-REM sleep is between 10 p.m. and 3 a.m. If you really got something to do and you want to get up early, but get to bed by 10. Now, those hours of sleep before midnight are so restorative. The first sleep is your body restoring. The sleep later is your mind restoring, and you need both. All right,
Yeah, thank you so much. So, lastly, we want to talk about where you can find treatment, and then we'll open it up for questions and answer. So, Holland Hospice, so we have a tobacco-free program with Tina, a Healthy Life program, and there's some flyers out front. Addiction Addiction Recovery, that's where Sarah is from. So they have a full level of service, anywhere from outpatient, they have intensive outpatient groups, and then they also have residential treatment for addiction. And then they also offer acupuncture, auricular acupuncture for smoking cessation, for pain, for lots of different things. And that's like a fee for service. It wouldn't be something that would go through insurance. And then a couple other things, some more techie things. Well, this is actually the Michigan Quit line. So if you call 1-800-QUIT NOW, they offer free nicotine replacement therapies for anyone in Michigan that is trying to stop smoking. 6 weeks of the gum, lozenges, or patch for free. So it's a great resource. I know people that have used this, and it really is just free. So, and that's true for vaping or tobacco products, either one. Truth Initiative is tailoring strategies. They already have a digital program for tobacco cessation, so they're actually gearing it towards vaping and towards young people who are trying to stop vaping. They have a whole kind of text program, tech support, and then also some apps that you can download or you can call the number for support.